Here, Chair of Nashville's Coronavirus Task Force and Chair of the Metropolitan Board of Health, and Dr. Gill Wright, Interim Chief Medical Officer for the Metro Public Health Department. Today, we will also have Hugh Atkins available to answer your questions specifically about enforcement. We'll begin now with Dr. Jahangir.
Hey, good morning, everyone. Thanks so much for joining us. Here's the latest on coronavirus here in Davidson County. Our active cases currently are 1,673. This is down from 1,795 this time last week. Brings our total cases to 96,306 cases, up 102 from yesterday. And our 7-day percent positive rate is 4.9, so it's essentially steady over the past several weeks. A rolling 14-day average of new cases is 128, and our 7-day average for cases per 100,000 is steady at 17.9, and a transmission rate of 0.92. Hospitalizations also in Middle Tennessee and Nashville stay stable. In Middle Tennessee, as of this morning, there are 307 individuals hospitalized, down from 317 just last week this time. And in Davidson County, 180 people are admitted with COVID-19, down from 188. And total number of deaths in Davidson County are 896. That is up 7 from our briefing last week. So far, 247,365 Nashvillians have received their first dose of vaccine, or roughly 35.6% of our residents. And 145,777, or 21% of our county, is now fully vaccinated. Of all those individuals 55 years and older, and again, I highlight that age because 91% of our deaths are in people 55 years and older, 62% have received at least one shot and 44% are fully vaccinated. 53% of whites over 55, 46% of blacks over 55, and 53% of people of Hispanic ethnicity over 55 have received at least one shot. Now, as you know, we're vaccinating everyone over 16, and we're working hard to meet Mayor Cooper's goal of having 50% of Nashvillians vaccinated by May. Now, we have ample access and availability of vaccine now, and I will let Dr. Wright speak more to that in just a few minutes. As previously discussed last week, now that we've reached our 30% threshold of Nashvillians receiving at least one dose of the vaccine, we can progress in our next steps in the city's reopening. As you may have seen yesterday, effective midnight tonight, the following changes will take in effect. Bars and restaurants can now stay open until 3 a.m., an extension of 1 hour, with a maximum floor capacity increased to 225. The maximum indoor event capacity has moved to 3,000 for conventions and so forth. And high-risk events such as wedding receptions and parties will generally increase to about 225 attendees. Indoor party size will move to 15 people, and this includes at restaurants and tables and so forth. And outdoor arenas with controlled access, such as Nissan Stadium, Ascend Amphitheater, Sound Stadium, and so forth, will go to 40% capacity. Indoor arenas with controlled access and seating, such as Bridgestone Arena, Ryman Auditorium, and the Opry House, go to 33% capacity. So as you see, we're making great progress. Let's continue, please, to get vaccinated and shoot for Mayor Cooper's goal of 50% of Nashville receiving at least a dose of this vaccine by May. We're so close. We're making great progress, and I appreciate everyone for doing their part, and I look forward to answering your questions. Dr. Wright.
Thank you, Alex. Good morning. Monday, our drive-through clinic at the former Kmart site opened and offered the one-dose J&J vaccine. Meharry Medical College is running that clinic. On Tuesday morning, we quickly switched to supplying the Pfizer vaccine after learning that the CDC and the FDA recommended pausing the use of the J&J vaccine. The recommendation was made after 6 cases of a rare but serious blood clot condition in individuals who received the J&J vaccine occurred. These all occurred within 2 weeks after receiving the vaccine. The 6 cases were reported to the CDC's Vaccine Adverse Events Reporting System, or VAERS. There have been a number of vaccination efforts using the J&J vaccine here in Nashville, and several have been vaccinated in the past few weeks. Hearing the news about the J&J vaccine can be concerning for those who have received the one-dose shot. That's why I wanted to let you know if you received the J&J vaccine more than a month ago, the risk is very low. If you received the J&J vaccine in the last 2 weeks, you should watch for the following symptoms: severe headaches, abdominal pain, leg pain, or shortness of breath. And if these have occurred within the 3 weeks after being vaccinated with J&J, you should contact your healthcare provider, or if they're severe, go to the emergency room. Let your healthcare provider know that you recently received the J&J vaccine. Adverse reactions are reported directly to the CDC and FDA, so I'm not aware of any occurrences here in Nashville. We continue to encourage those with scheduled appointments for Pfizer and Moderna vaccines to get vaccinated. If you're scheduled to receive the J&J vaccine, please contact your healthcare provider, vaccination location, or clinic and change your appointment to a Pfizer or Moderna vaccine. Again, the health department has followed the CDC and FDA's recommendation to pause all of the use of J&J vaccine and will only begin offering the vaccine again at our drive-through clinic once the experts at the CDC and FDA give their approval. We began offering the 2-dose Pfizer vaccine by appointment at Music City Center on January 30th. And since then, we've given nearly 2,000 doses of the vaccine each day. An additional 10,500 appointments slots will be open tomorrow for the upcoming 2 weeks. This week, for the first time, several appointments remained open at Music City Center. We want to keep the momentum going strong, and in an effort to reach 50% by the 1st of May. So starting Monday, April 19th, Metro Public Health Department will begin offering the first dose of the Pfizer vaccine to the first 500 walk-ins each day at Music City Center. This is in addition to scheduled appointments. That's the first 500 people without an appointment, and they can come between 9 a.m. and 3 p.m. to receive their first dose. We still recommend making an appointment, especially if you're wanting to get your first shot at a specific time. Appointments to get the first dose of vaccine are scheduled between 8 a.m. and 4 p.m. I urge anyone who has not yet received a vaccine to visit the covid19.nashville.gov website or to call 615-862-7777 to schedule an appointment at Music City Center or the drive-through vaccination location at 2491 Murfreesboro Pike. As of today, as Alex mentioned, greater than 35% of Nashvillians have received their first dose of vaccine. With everyone's help, we will reach our goal of 50% by May. To do this, we need everyone's help. Also, if you've already gotten your first dose of the Pfizer or Moderna vaccine, please get your second dose. If you're a Davidson County resident and got your first dose of Pfizer vaccine at a clinic outside of Nashville, Davidson County, you have an option of getting your second dose at Music City Center. Just bring your vaccination card and we will get you your second dose there. According to the CDC, COVID cases continue to increase in several states. Getting your shots, the best protection against the variant strains of COVID that are being reported. We need everyone to do your part to get vaccinated to keep case rates down and going in the right direction here in Nashville. Each person that is vaccinated is another step closer to further opening our city. Alex provided the changes to the public health order after we have reached the 30% mark. Those will go into effect at 12:01 on Friday. We are currently at 35%, and additional changes will be made when we reach 40%. With your help, that will happen in the coming weeks. Thank you, and I'll turn it back over to Brian for questions now.
All right. Well, thank you, Dr. Wright. We'll start with Brett Kelman at the Tennessean. Go ahead, Brett.
Good morning. Can you guys hear me? Okay. Two-part question. First, the announcement of walk-in vaccinations is very interesting. Is that happening specifically because this was the first week when MCC didn't fill up all appointments, or do those two events just happen close to each other? Like, was that the trigger to opening walk-in appointments?
Yes, that was the trigger to open that up, although we had planned at some point to be able to open it up to walk-ins. This just triggered that happening at this point in time.
Okay. Second question. So the Nashville Scene published a very interesting story this week, identifying an East Nashville woman as one of the 6 cases that had blood clots as a suspected link from the Johnson & Johnson vaccine. But it sounds like Metro Health just said that they're not aware of any of the complications from the Johnson & Johnson vaccine inside of Nashville. And I'm curious if this is something that you think Metro Health just isn't clued into, or are you actually disputing the content of that story? Is Metro Health aware of a East Nashville woman having complications from the Johnson & Johnson vaccine?
I'm aware only through the reporting that's been done by Nashville Scene and others. Anytime that there is an adverse event, the reporting system is through that VAERS, reporting system, and that goes directly to the CDC and to the FDA, because they're obviously the ones that have licensed the vaccine. So we are not always notified. Now, through the reporting, I understand that somebody here in town has had one of those people, but I can't verify or anything. It's just, but the one thing I did note about her experience was she said, even having had the experience she did, she recommended getting vaccinated to everyone. So I think that speaks, I think that's the right answer, but we just have to be prepared for those types of events.
Thank you, Dr. Wright.
Sure.
Let's see. We'll go next to Alexandria Adams at Channel 4. Go ahead, Alexandria.
Good morning, everyone. 2-part question for me as well. Will not having the J&J hinder the goal of getting that 50% mark by May? And then my second question is, with the J&J vaccine now out of the mix, how do you guys plan to remind people to come back and get vaccinated, specifically over at the new drive-through at the old Kmart in South Nashville? Thank you.
Well, I'll take the second question first. The reminder system is still what we've been using all along, which is that we text individuals about their appointment and their follow-up appointments. What we will do, we very quickly were able to transition. We literally found out at 6 a.m. and by the time the site opened at 8, we had transferred over already to the Pfizer vaccine. We do have a good supply, and we don't think that will hinder us being able to offer the vaccine there. But we will continue we'll actually have those people that get Pfizer at the drive-through come back in 3 weeks, same time, same place to get that at this point is the plan. So Alex, you have anything you want to add?
Yeah, I mean, I think to your question of will the J&J, not having J&J impact our 50% goal? Well, here's the thing, I think we've highlighted here, there is ample vaccine. We are not limiting any events. In fact, I think Meharry's having an event this weekend. Several other events are going on. Mobile events are going on in town. The best way for us to get over this entire pandemic is for everyone to get a vaccine. The Pfizer and Moderna vaccines are a different platform than the Johnson & Johnson vaccine. There have been hundreds of millions of people who have received the Moderna and Pfizer vaccines, and there have not been anything that's triggered them to be paused. In fact, I just saw a study that showed of the 66 million Americans that have been vaccinated fully, there have been 0.008% incidence of cases. So 0.008, so 5,800 cases out of 66 million people are fully vaccinated. Vaccines work. The Pfizer Moderna vaccine have been shown to be very effective, appear to be very safe. I think maybe we should take some comfort to know that when the 6 cases out of 7 million of Johnson & Johnson that triggered them to pause shows how sensitive our system is to safety. And so I just want to reiterate the 50% goal is attainable. We need all Nashvillians. In fact, I just saw, I think the Vanderbilt poll that said that 70% of Nashvillians are wanting to get the vaccine. Well, that means there's 35% of Nashvillians who want to get vaccine haven't gotten it yet, right? So go get the vaccine. We have ample availability. Is they're safe? And I'll step off my high horse now. Thank you.
Thank you, Dr. Jahangir. We'll go next to Blake Farmer. Good morning, Blake.
Hey, Brian. I wanted to ask about two things. Variance is one, but the other thing I wanted to start with was breakthrough cases. And I know I'd asked, it sounded like you all are keeping pretty good track of how many cases you all have had of folks who have been vaccinated, which I know is expected. But like, do you all have a new number on that, Dr. Wright?
I don't at this very moment. I know that we've been tracking them. I don't have it for my EPIs yet this morning.
Okay.
So,
but is it sort of still tracking basically with the kind of real world data?
Yeah,
of the test. Yeah.
Right. It's been tracking pretty much along with that. What we do is we fully investigate those, report them to the state, and then they report them obviously and also to CDC. We want to make sure that if we can, that they get the sample, that they're checking the sample that was positive in the individual to see if it is a variant or something different. But and then once in a while, we'll get a report of somebody being thought to be a breakthrough, and when we go investigating, they never actually received the vaccine. So we're checking all of those types of things just to be sure that they truly are true cases.
Gotcha.
And Blake, regarding breakthroughs, if I can just reiterate what I just said, study just came out, fully vaccinated, 66 million people, 0.008% breakthrough. And so vaccines work. Sorry.
And breakthrough meaning even getting a case. We're not talking about deaths. We're talking about just
cases.
Getting sick.
All right. And the other thing is on variants. And I asked because I'm not sure I fully understood how we were even knowing what variants were in Tennessee or Davidson County. Are you all working with, I mean, I know Aegis is now doing sequencing on a much larger scale. Are you all working with lab companies to more often do sequencing? Like what is the process at the moment?
The process is kind of twofold. Previously, there was always a small percentage of the positive cases that go to the CDC and are actually sequenced to see, and that's when that started to show some of the cases that were coming into Nashville, Tennessee as a whole. But the other piece is if somebody presents in an unusual fashion, meaning they have more symptoms, different symptoms, that type of thing, where the physician that's treating them thinks that they may have a variant, those are also isolated and sent for sequencing.
So you're saying that that cases that have some unusual presentation for some reason, which I assume means that they're hospitalized, that those are the folks who actually end up getting their test sequenced?
They could be hospitalized, but they don't have to be. I mean, they could be an outpatient it just presents a lot different. You know, initially, if you think, we didn't understand that loss of taste, loss of smell was part of this. If we saw a new symptom today, loss of hearing hasn't happened, but if you saw something like that, then that would be a reason to do sequencing, because you would want to see if there's something different going on there.
All right. And then my sort of like bottom line on this is, do we feel like Nashville has been hit with the variants yet in a real serious way? I mean, as they're sort of thinking maybe going on in Michigan?
Actually, it's closer than that. It's going on in Memphis. And we're watching closely. Memphis, I think there was an article that they, at the first of this month, had about 10% of the UK variant, and they expected over the next several months for that to potentially take over and be the sole variant causing illness. So, you know, so they're.
I really have not been paying attention. So they're having a variant outbreak to some degree.
Yeah, we know that this variant, a lot of the variants spread quicker and easier. So when that happens, then they're obviously going to become the predominant infective agent then.
All right, thank you. This is all helpful. Thanks.
Thank you, Blake. We'll go next. I believe this is the last question based on hands that are up to Vivian Jones. Good morning, Vivian.
Good morning, everyone. Thank you so much for taking our questions today. I have a two-part question on reopening. With the news that 35% of Nashvillians have one dose of vaccine, are there plans for a further step of reopening when we reach 40 or 50%, as we did with 20 and 30? And then also, I was curious what metric or percentage vaccinated are you all looking at for a full reopening? The reopenings have been kind of incremental in capacity changes. Is the previously outlined phase 4 still going to happen at some point? And would that happen when there's no more cases in Nashville or a herd immunity vaccination rate? Like what kind of metrics are you all looking at for that?
Sure, Vivian, thank you. So I believe Dr. Wright mentioned in his remarks as well, but we will at 40% further increase the reopening. So let's look at that first. When it comes to when do we go back to essentially normal, which is a superb question to ask. You know, I want to maybe step back. I don't think we will ever get to a point, at least in the near future, where there'll be 0 cases. Right? I think everyone should be comfortable knowing that COVID is going to be endemic in our area. There'll be cases reported daily. You know, people will be hospitalized just like they are with flu and other diseases. That's why getting vaccinated is so important, to try to minimize that and to try to minimize its effects if you do get sick and you've been vaccinated. With that said, you know, a public health principle is that public health measures are needed to try to I'll use the word protect a public from illness when there's not a readily available intervention. Well, we are now getting to a point with the vaccine that there's a readily available intervention that is available to anyone at any time. And so I think as a matter of policy, we need to start really evaluating what that means and start needing to make decisions such as the ones that you've mentioned. When do we go further open? I think we are getting to a point where there isn't going to be an equilibrium of vaccinations, equilibrium of people who have a choice to get vaccinated or not, but that also gives them the choice to get more sick or not. And I think that our role in public health is to protect all of the public health when there's not good interventions available. And we're getting to a point where there's a lot of good interventions available. So we're going to keep reopening. Let's get to 40% and turn that dial really quickly. And then I hate to make any promises beyond that at this point, but let's keep doing it. So get vaccinated, everyone, please.
Just one quick follow-up. Is that previously outlined phase 4 from last year? Is that something that you all are still talking about, or would a change be?
Well, I think this whole thing has been very fluid, right? So when we put that out in April, May, whenever that came out, I mean, it's obviously very changed, and I think we've been transparent with the changes we've made and why we've made certain changes. But I think I don't recall the exact details of that exact phase 4, right? But I haven't looked it up. But look at what we've done. Like, we've now increased conventions to 3,000 effective at midnight tonight. We're increasing weddings to 225. The soccer game this weekend can be at 40% capacity. You can go to the Ryman at 33% capacity. Bars are open till 3. I mean, we've made gradual increases in everything as quickly as we can in a manner we feel safe. And so, the question of when do all reopening metrics just go away? I think again, we need to hit a point where everyone that wants opportunity to be protected can be protected, and we're hitting that point at a reasonable pace now.
Thank you.
All right, those are all the questions that we have. Our next COVID press briefing will be held via WebEx on Thursday, April 22nd at 9:30. Thanks for joining us, and this concludes today's briefing. Thank you all.
Thanks, everyone.